Hello, everyone. Welcome to this episode of Health Unscripted. My name is Ashley Holsworth-Nash, and I'm the Vice President of our Retail Network Product and Solutions for Express Scripts by Evernorth. As you may have seen, Evernorth recently announced that it will transition toward a new pharmacy benefit model where discounts negotiated with drug companies, otherwise known to many as rebates, are directly available to Americans when they are at the pharmacy counter buying their medications. We're essentially working to eliminate the complex post-purchase rebate process by making the discounted price of the drug readily available and transparent, really from the start. I am very excited to have here with me today Adam Kautzner, the President of Care Management and Express Scripts. Let's start with setting the stage and some context as we are moving into our new models. So really, what led to the evolution of the pharmacy benefits?
Sure. The pharmacy benefit model has delivered significant value over decades. We've been able to continue to help not only consumers, but also employers manage drug costs throughout that time period. We've been very successful in helping consumers be able to realize the cost savings from generics and biosimilars. But even with all of that, today affordability continues to remain a challenge in healthcare. And the pharmacy benefits market is continuing to evolve and change at a rapid pace as well. And our shift is what we think the market is demanding, that we are going to launch a new era of pharmacy benefits, and we're thrilled to be able to bring this to market. There's a few things that are going to be changing that will be very different from what we're launching with this new model versus where we currently are and the rest of the market is. Now, first off, rebates are today negotiated with drug manufacturers. Those are applied retrospectively, and in many cases, the consumer doesn't receive the benefit of those at the pharmacy counter. We're changing that completely. We're going to be moving to a rebate-free model where we're negotiating discounts upfront for the direct benefit of the consumer, where they can realize the savings that they're able to achieve, that we're able to contract on their behalf. We're removing the complexity out of the model, so we're going to simplify it to improve the overall member experience, which will also, in improving accessibility, drive better overall adherence for patients as they take their drugs. And it's going to lower overall total cost of care for patients. We're going to move to a reimbursement model where we're able to reimburse pharmacies at what they're able to effectively purchase the drug at, while also providing an additional dispense fee. That's going to make these pharmacies be able to be more sustainable and be able to serve the broad populations that they need to, and continue to have that broad access to care, which is important to us as an organization. And we're also going to be able to provide better overall transparency that will provide a really important component for the community pharmacies, so that they can understand what they're spending on these medications and what we're able to reimburse to improve the overall clinical services that we're able to provide to these patients. That's an important piece, as physician care continues to be a challenge in some areas from an access perspective. These community pharmacies can do so much more than dispensing drugs, and we're working with employers and pharmacies alike to ensure that access is available for patients.
We know point-of-sale rebates have existed for years, and some clients have taken advantage of that in the industry. But when we release a rebate-free model into the future, how is that different than point-of-sale rebates?
The traditional point-of-sale rebate model today is not a good overall experience, both from a client perspective, but also from a patient perspective. There still is the opaqueness that exists within rebates today, and it creates challenges. What we're talking about here is brand new. It is upfront discounts that we will negotiate with every drug manufacturer in America that we have contracts with today, but it's upfront, it's transparent, and it's where our members can realize 100% of the savings that we're able to negotiate on their behalf with these upfront discounts. We apply it immediately when the patient comes to the pharmacy counter, and it's where real savings can be had. We expect to have about 30% on average of savings for patients that are taking branded drugs that may be in a high deductible health plan today, or they have a very high co-insurance. So this new model gets to immediate upfront lower prices. It delivers better overall satisfaction and improved overall adherence and health outcomes. And it helps to, again, restore the trust within our healthcare system.
A lot of what you said up until this point continues to circle back to the member. You're a pharmacist, I'm a pharmacist. Focusing on the member really speaks to our heart. So can you describe in a little bit more detail the millions, over 100 million Americans that we serve? How should we think about their impact from this new model and this big change that we are making?
So today, Americans have the lowest generic pricing in the industrialized world. And we as an industry have been very successful helping realize for our clients and for Americans the benefit of generic drugs. And today, generics account for about 9 out of every 10 prescriptions that are dispensed in America. And we've been very successful there in the amount of savings we've been able to provide. However, branded medications, although they account for only about 1 out of every 10 prescriptions, they account for over 88% of the cost of medications today in America. That's too high. And we have to continue to work to be able to bring that down in new and different ways. And we're going to be able to ensure with this new model that we can address those 10% of prescriptions, those highest cost medications, and be able to bring that cost down for Americans so that they don't have to make the trade-offs that they may have to make today in certain cases around drugs versus other things within their lives. And we are going to work to address for those patients in the high deductible health plans how we can bring down that cost significantly on the medications and be able to have them be able to realize the savings so that they can access the drugs that they need, they can take them as prescribed, and they're able to realize the full benefit of those medications. So I'd say to sum it all up, patients today are benefiting from lower prices at the pharmacy counter in certain aspects around generics, but they need it for all of their drugs. And rather than waiting for a retrospective rebate or an estimate, or they may not even receive any of that discount today, we're going to put all that up front. So the patient receives all of that benefit so they can realize the full benefit of that drug and they can lead healthier overall lives.
Let's stay in that vein of affordability right now. There have been some that have said, how can we make this change without resulting in increased costs for the plan? So thinking on the plan side of it, knowing all the benefits that we're going to have on the member side of it. What would you say to some of the folks that are kind of poking at it a little bit, saying that it's going to increase the cost for the plans themselves?
Ashley, this is a fundamental redesign of how we're going to be working with drug manufacturers and pharmacies and everyone that's involved within the supply chain of drugs in America. We're going to be able to simplify the system, lowering costs for Americans. We're going to be able to improve access for patients for these medications. Now, today, drug manufacturers do spend a lot of dollars trying to work to offset the deductibles and high co-insurance that some patients may have within their benefit. Those dollars are going to be less needed in a model like this. They may not be needed at all going forward. So that value, we believe, can be applied upfront for benefit to patients. It also can be used to help to offset any premium increases that may occur. And also keep in mind, today, it's very common that 1 in 10 prescriptions go unfilled or not picked up at a pharmacy counter. Many times that's because of cost, unfortunately. We're going to be able to reduce those types of issues, which, again, helps patients access the drug, stay on the drug, take it as prescribed.
So when we think about the sponsors kind of working in this new environment with these new options of these benefit designs or these new options of models, how will the new pharmacy benefit model improve the experience for our clients, specifically those plan sponsors that we are working with?
The model that we're talking about here is going to be based off a simple fee that we're able to charge. You can think of that as an administrative fee. It might be on a per prescription basis or a per member per month basis. What's important, though, is the charge that we'll be charging our clients is going to not be based off of the cost of the drug. Our plan sponsors are going to gain more of the real-time visibility into the drug costs. It's going to help them from an overall how we forecast, how we're able to budget, and we're able to project out the different trends that might exist within the market. So it's going to streamline those pieces. It reduces the complexity. It's going to make it easier for our plan sponsors to be able to make decisions and manage their overall pharmacy benefits. We're going to be able to also work through to simplify the financial components as well. We're still going to allow for audits and those types of things that exist within our industry with full transparency here. But it's going to be getting even easier to digest type of format. We're going to be able to work more closely with our clients, focusing on the things that matter, right? Member satisfaction, better overall adherence, the health outcomes of our patients. We're a company made up of hundreds of different clinicians that are focused on these types of things. So our ability to engage with our clients to improve the lives of the patients that we serve is going to be very important. We're going to put even more energy going forward. So this model provides better alignment from an Evernorth perspective with our clients and how we're compensated with the simplified fee that's not going to be based on the list price of the drug. So we're thrilled about that and that we're going to be able to bring this type of new thinking to the market. And thus far, we believe it's going to be very well received within the market overall.
There is not a day goes by that for my role or just my life being a pharmacist, I don't talk to someone who's affiliated with a pharmacy owner, or working in some aspect of being a pharmacist who's in direct patient care. So we think about our local pharmacies that are serving a lot of our vulnerable patients who are in some of the areas where they are the healthcare provider for our members. When you think about this model, how do you think about this model supporting those local pharmacies, those local pharmacists differently into the future?
We today have over 20,000 independent pharmacies in our network. Here we're able to work with them differently, be able to reward them for better clinical services they're able to provide to our patients. I think long-term, that's a big benefit where pharmacies, there is a financial reward if they take care of their patients and the outcomes of their patients are better. We're able to track that. We're also able to provide them with additional reimbursement for services that are needed within their communities. So as long as they can maintain the high clinical metrics, they can provide the health screenings and different testing that is going to be needed by our employers and clients in those areas and serve those critical access to care areas. I think this is a definite win-win all the way around. We're confident that we're going to be able to continue to negotiate to keep our market-leading rates in the market, both on the pharmacy side and the drug manufacturer side, but also be able to provide this fair reimbursement overall. So this new model provides us with a lot of opportunities there, and we expect to see patients as the big benefactor here, where they continue to have broad access, but additional services at a reasonable cost that'll be available to them with the new model.
That's incredibly exciting, not only for the pharmacies, but for the members that they are serving. So I want to ask you one final question here, Adam. We're making big changes. We're making bold changes for really every part of the ecosystem in which we are residing, in which we are touching. So we have really thought through a pathway forward. We've thought through how we can be part of this and how we can start to influence those around us and start to make these changes come to life. But when you think about the industry, how do you see the model that we are creating influencing the overall directions in the pharmacy benefit industry over the next 3 to 5 years?
Yes, well, I don't have a crystal ball, so don't hold me to these things, but I'll take a stab at it. I would say one, certainly greater transparency. That is going to become the norm as technology continues to improve, the demand from the consumer continues to improve. We want more transparency. We want it faster. We want to have more empowerment as a patient within the healthcare ecosystem. So I would say that's certainly going to be one component. Secondly, as I touched on in that last question, the pharmacy reimbursement piece is going to continue to evolve and reward those pharmacies that can provide the best clinical services for their patients, where they're able to keep their patients healthier and out of the hospital. I would say third, PBMs are going to continue to be even more strategic partners within the healthcare ecosystem with our clients. The amount of data and scale and clinical expertise that we have is going to continue to drive more affordability and creative solutions that will improve the healthcare outcomes of the patients that we serve. Four, the regulatory reform is going to continue to accelerate. We're going to have to continue to be ready for that within our industry, help our clients be able to navigate it, help patients be able to manage successful change in that area, and ensure that we set the standard for compliance to whatever those regulatory changes might be. And ultimately, I think the industry evolves back to much more of a volume-based type of care model with a value-based type of backbone, where we're compensated for providing better overall services to our patients. And that's going to play a very centralized role to the whole person health component that we continue to focus on here at Evernorth Health Services.
Adam, thank you for all of that. You may not have a crystal ball, but you certainly have a vision. You certainly have grit, and you certainly have enthusiasm and excitement about the future. And I can speak just from being in this organization, you have the drive and you have the passion from the team beneath you that you have curated to really drive us into a future that we are all very excited and very proud to be part of. So thank you for everything here today, and thank you for how you are striving and pushing us to really change the industry for better for all that we serve. That brings us to the end of this episode of Health Unscripted. This has truly been an insightful and an exciting conversation that gives us all a lot to think about.